While most of your clinical growth next year will involve direct patient care, we certainly think it's important to augment this with a robust didactic and experiential learning program. While I do think that didactics are important, we also recognize that the way that residents are learning is changing, and we want to be sensitive to this. Therefore, in yellow, you can see the areas where the preliminary and transitional residents are not required to go to conference. The remainder of the time includes grand rounds and interdisciplinary conference. We have case conferences by the residents for the residents on Wednesdays, and Thursdays involve our ambulatory or diagnostic lecture series to deal with common medical problems. On Fridays, we have more of a visual component, including EKG conference, chest x-ray. We will do things later in the year, such as dermatology or ophthalmology. Likewise, we have tried to decompress our noon conference schedule to adapt to the changing learning styles of our residents. Therefore, as you can see here, the conference times highlighted in yellow are times where you're not required to be in conference. We will begin the year with an emergency lecture series to go through all the common medical problems that you're likely to be called about, including things like chest pain or shortness of breath, or somebody has stopped peeing or they become delirious, and how do you deal with those things? And after that, we go by body systems. And so, for example, we would do a month of cardiology where you have core lectures of cardiology on Mondays and Wednesdays. We will do board review of that same topic on Tuesdays. And I should mention also that the ambulatory schedule is something that applies to our categorical medicine residents and will not impact you. And finally, we'll have some other things that are required by the ACGME, including patient safety or M&M, and also try to give you a background in evidence-based medicine. We've been really lucky at Riverside that our administration has invested in medical education. One example of this is the Gibbons Medical Education Center that opened up in 2017. This is a wonderful space that we will hold most of our lectures in. It also allows for small areas for breakout and for rounding for some of our different rotations.
Recognizing that PowerPoint-based lectures are not the most effective means to teach residents, we've placed an increased emphasis on case-based learning, where residents will be able to present cases that they've seen during the month prior so that their fellow residents can help to consider various workup, differential diagnoses, and treatment plans.
In addition to our didactic schedule, we think that experiential learning is also extremely important. Our Center for Medical Education and Innovation has been around for roughly 15 years now, and we continue to expand its capabilities. We will do a number of things throughout the course of the year. This will include things such as procedural training, where you will do procedural entrustment at the beginning of the year and have just-in-time training for some of the common procedures you'll be expected to do through the course of the year.
Perhaps one of the greatest enhancements that we've had in our curriculum this year has been a full integration of our experiential learning. Our chief residents have developed a very robust curriculum that will go throughout the course of the year. This will involve all interns, as they will be separated into several different groups during the noon hour every other week, where they will go through point of care ultrasound, ultrasound-based procedural training, and then team training for various patient scenarios that would be low frequency but high risk.
Lastly, we have tried to greatly enhance our overall utilization and comfort level of our residents with ultrasound. This includes the use of a high fidelity ultrasound simulator with three-dimensional visualization and haptics.
Over the last several years, we have greatly expanded our use of ultrasound on the floor as well. We have a number of faculty members that are very adept with the use of ultrasound, and we have incorporated that in a number of our rotations. We recognize that ultrasound is an integral part of patient care in a number of different specialties, and we want to make sure that we foster that in each of our residents.